Hear the whispers from within, balance to restore, ailings to relieve. Feel the nature keeping us, nature healing us, flowers, leaves, and roots within. Hear the mind calming you, soothing you, love and kindness inside out. Let the herbs from middle world heal. Welcome wellness, welcome wellness. It's revealed herbs, middle world herbs.
Hello and welcome to the Middle World Herbs Natural Wellbeing Series, where we talk about restoring and maintaining your health in safe and natural ways while incorporating both the physical and the emotional sides of healing. We go live twice a week on Wednesdays and Thursdays at 4 p.m. Pacific Standard Time, and every single time we talk about a different aspect of health. Well, today we are talking about the uric acid detox, and we're going to focus on kidney health and natural body detoxification processes. How to flush out uric from the body and get rid of gout naturally, how to safely detox the liver, and what's the #1 supplement for gout relief and kidney support. We have selected the top 20 hardest questions from our listeners, and we are going to get them answered today. My name is Deanne. I'll be your host, and then I'm here with our special guest, Dr. Jacquie Leone, a naturopathic medical doctor, board-certified holistic nutritionist, and a psychology enthusiast. Welcome, Dr. Jacquie.
Oh, thanks for having me again, Deanne. I appreciate it.
Absolutely. So today we're talking about what is the uric acid detox. And if you wouldn't mind just introducing yourself and maybe sharing some of the common kidney health related issues you see with your patients.
Yes, absolutely. I would love to. So I'm a naturopathic physician, and in naturopathy, we believe in treating and or addressing the root cause of an issue. So 9 times out of 10, when patients come into my office, it's not really going to be kidney specific. Again, that's just the majority of the time. There are exceptions to every rule. However, what they do come in with are things that cause kidney issues. And they're kind of starting to recognize and or notice when kidney problems are arising, right? Changes in urination and stuff. So the 2 things, maybe 3 things that I notice that affect kidneys the most are going to be hypertension. My patients with hypertension tend to have kidney issues secondarily. Diabetes, my diabetes patients tend to have, again, secondarily kidney issues. And sometimes high cholesterol, obesity, but not every time. And so those are usually more than not what I'm seeing in practice in terms of kidney issues, but I've seen kidney infections, kidney cysts, something called glomerular nephritis, which is inflammation of the functional unit of the kidney. The beginning stages of kidney failure, all of those things have come across my door in practice. And those were all kind of exceptions to the rule because of outlying or outlier issues. But again, most kidney issues are secondary to other things going on. And that's what I tend to see most in my practice.
Okay, really interesting. Well, before we jump into all the hard questions from our listeners, I want to introduce an amazing supplement from Middle World Herbs, and you might want to consider it for your kidney health, especially if you are dealing with gout, poor uric acid elimination from the body, and you just want to look for something more natural to support your urinary tract health. So Middle World Uric Acid Detox, that is this one. This is a powerhouse of benefits for the kidneys. Now, regularly on Amazon, it is $16.99, but I have really good news. Because you guys are on our live with us, we have a 20% off coupon on Amazon Live. So you just click the banner and then that will automatically apply that discount. And it's only valid today and only while we're live. So you might want to grab yourself a bottle of this natural kidney health support from Middle World Herbs and enjoy 20% off at checkout. And now let's get into the hard questions about kidney health from our listeners. And if you have a question too, just type it in the chat and we'll make sure we get an answer from Dr. Jacquie, who's our amazing expert in naturopathic medicine. So our first question comes from Darlene. And Darlene, if you're listening with us today, here's your question. She asked, how do I know if my kidneys are working properly? Can I somehow test them at home?
I get this question asked a lot, especially people who have UTIs. I know those are urinary tract, but sometimes when those go unaddressed a long time, they can create bladder and or kidney infections. And there are a couple of ways not to necessarily treat or diagnose kidney issues, but just good ways that are great monitors and screening tools. So the first thing is the color of your urine. Is it clear or pale yellow? The richer or more golden or orange the yellow usually indicates the more dehydrated we are. So if we're not hydrated, we don't have enough fluid in the body, the kidneys can't really do their job as well. And so they're going to start to suffer over time, right? Which brings me to my next point. How many times are you urinating, right? So we want to make sure we're urinating usually 6 to 10 times a day is pretty standard. Anything less or anything more could be kidney related, also bladder related. So, again, these aren't definitive, this must be the kidney issue or ways to know. These are just general screening tools or ways for you to kind of check in and be more aware of your bathroom habits, things around your kidney and your kidney health. Now, if for any reason you have chronic UTI, you are diabetic, maybe you're on the keto diet or something like that, or your urine isn't an appropriate color, or you're urinating more or less than what I discussed, you can buy over-the-counter dipsticks for urine. And that is a generalized screening tool to know whether or not you should go see your physician. So some of the highlights, because some will test 3 things, some will test 12 things on the dipstick. If you've ever seen that, sometimes they'll do it in the doctor's office, and it gives you a color, and then you hold the color up to the results list, and you kind of see. Those are usually testing pH or the acidity level of the urine, and you want a very specific number. Too alkaline isn't great, and too acidic is definitely a potential sign that the kidneys are suffering. So pH is a great indicator on that dipstick. Second thing is blood. Is blood present? Because that could be signs of a kidney or bladder infection, also a UTI. A couple other things: are there proteins, glucose or sugar, and ketones present in your urine? Because those are, again, things that the kidneys need to take care of, and it's the kidney's job to filter some of that stuff out, and or make sure that that stuff gets in the urine. So if there's too much or not enough, we're not within the range we need to be in, that could be a sign that kidneys are suffering. And so if you think that you could have a potential problem, and you want to try those dipsticks, by all means, give it a try. But otherwise, honestly, safe than sorry, just go see your physician if you can. And again, if not, if resources are limited, maybe you don't have insurance or access to quality health care, a dipstick could be a good idea to at least give you some information, so that when and if you do go to the physician, you have something to show them.
Okay, good info. All right, next question. This comes from Easy Garcia. Doctors say that my labs are okay, but I feel really tired, more than I used to. Should my kidneys be on the list of potential suspects? But they don't hurt me.
So if you're more fatigued but your kidneys aren't showing any direct signs or symptoms, fatigue usually isn't always a big indicator of kidney problems. If anything, you could just be something as simple as dehydrated, right? Because when we don't have enough water in the body, we can't eliminate toxins, and we can't kind of clean ourselves out. What I think of when it comes to water, because some people are like, oh, I don't like the taste, which is fine. If you don't like the taste, you can add herbs or, cucumber or berries or something, but just make sure you drink water. Imagine taking a shower. We shower daily, most of us. Imagine taking a shower and halfway through the water cuts off. And then you have to go through your day like that, kind of soapy, a little dirty, a little clean, kind of somewhere in the middle. You're not going to have a great day, right? You're going to feel a little crappy. Well, take half showers like that with the water cutting off midway for a week. How would you feel? How about a month? How would you feel? That's essentially what we're doing to our body when we don't drink enough water. We're shutting off the cleaning process halfway through. And so that gunky buildup will happen and affect our kidneys. But in terms of fatigue associated kidney stuff, you want to make sure that you're getting good sleep. Again, you're hydrated. If you're nutrient deficient, that could add to fatigue and not be related to kidneys. Hormone imbalances like thyroid issues can a lot of times lead to fatigue and not be related to kidneys. In rare cases, it can be related to kidneys, but there are so many other things to be considered, like medications and supplements and stress level. And again, like I mentioned before, sleep. So if we're feeling fatigued, we don't want to jump 12 places, or 12 steps and go into immediately, oh, my kidneys have issues. There's a lot of information we need in between. Could it be part of a kidney issue picture? Maybe, but is it likely? No, there's a lot of things that come before kidney issues that fatigue is more associated with, that you might want to consider looking into before the kidney stuff, if that makes sense.
Yeah, no, that totally makes sense. Okay, our next question. Balmy Bina says, I am 30 years old and I have slight hypertension. What are my chances of getting kidney problems down the line?
Believe it or not, uncontrolled hypertension, even mild, is a significant risk factor for kidney issues, especially kidney failure. And research actually shows that there's almost a 30% increase of those that have hypertension that will eventually develop kidney disease. So that's a pretty high number to me, 27 to 30%. So if you do have hypertension, regardless of your age, it's only going to progressively get worse if we don't address it. So the value of being 30 and having just slight hypertension is you're both young enough and your numbers are low enough to where you can address it now, prevent and or address the issue, right? Get rid of the hypertension before we get over the age of 40. And that way we're completely eliminating the risk factor of kidney disease in that case. But otherwise, do some stuff. You could do stuff for slight hypertension, not eat as much salt, drink more water, high nutrition, exercise more, get quality sleep, deal with your stress. Again, all the basic fundamental pillars of quality health. And most times that will correct itself. And when in doubt, you can always seek the care of your physician, maybe get on a very low dose beta blocker if you need it, just again, to help manage the blood pressure. The sooner the better, right? That's always going to cut down risk factors for developing secondary disease states, for sure.
Yes. Okay, the next question is from Lee S., who said, my ankles often swell, especially in the evenings. Could that be related to kidneys?
Absolutely. Not directly definitive, like 100%, but it could. Very, very likely. So decreased kidney function can lead to sodium retention or salt retention. We kind of know it as swelling, edema, bloating, whatever you want to call it. It tends to happen in the feet and the ankles because, first of all, they are our foundation of our body. It's what we walk on. It's what we need to move around. So they're getting a brunt of a lot of the pressure, right, of our body weight in all of our joints all day. But in addition to that, they're the furthest thing away from the heart. So if the heart has issues pumping blood to your feet and your ankles, that gas exchange or fluid exchange that the heart and kidneys do together could be really challenged. And so we're retaining that fluid in the ankles and in the feet. And we're noticing it at the end of a long day because we're using our feet all day. So not only are they taking the brunt of pressure, right, and changes in pressure, we're stepping, we're releasing, we're stepping, we're releasing, we're standing. So not only is it the pressure all day, every day, but also at the end of the day, we've eaten 3 meals. If we're eating a lot of salt and we're retaining a lot of water, our body's pretty cool and vital in the way that it likes to maintain a very specific, what's called osmolarity, right? So think of like the ocean. If you dumped a ton more water in the ocean, you would need more salt to get to that same ratio. If you dumped a ton of salt in the ocean, you would need to increase natural water to maintain that saltiness, right? Water to salt ratio, where the body is exactly the same. So if we eat a ton of salt, guess what we're going to do, everyone? We're going to retain water. So if you have edema, if you have ankle or feet edema, lower leg edema, swelling, bloating, you retain water really easily, really pay attention to what you're eating in your diet because chances are it is associated to salt. And if it's not, it might be heart or kidney issues. So definitely talk to your doctor about getting that checked out.
Yes, definitely. Okay, next question. I feel like you're just on rapid fire. I love it.
I am.
Okay, this next, I know, it's like, let's go. The next one comes from Jeffrey. Does uric acid cause kidney stones?
Not historically, like it very well can, but only like 5% of kidney stones are actually uric acid stones. Uric acid tends to take what's the word I'm looking for? Shelter, I guess, in the big toe. And that's what causes gout, but other joints as well. Uric acid likes to hide in joints for whatever reason, but very rarely will it accumulate in the kidney and cause kidney stones. Most kidney stones are called calcium oxalate stones. That's about 75% of kidney stones are calcium stones. And that's a whole nother issue to discuss. But in terms of uric acid, if you do have uric acid buildup, only like 5 to 10% of kidney stone cases are related to uric acid. So it's possible, but not likely, if that makes sense.
Yeah, no, that totally makes sense. Okay, so Joe made the following comment. I'm on a lot of medications. Should I worry about my kidneys? And which meds could be toughest for my kidneys to handle?
This is a really, really good question. Very good question. And the reason is because polypharmacy, poly meaning many, pharmacy meaning drug, is very common in the United States. If you are on more than 2 to 3 medications, you are considered polypharmacy. Chances are you're taking a medication, like let's say a beta blocker for heart stuff. Well, guess what heart stuff can sometimes do? Retain water. And so you're put on a diuretic pill. But guess what happens when you're on diuretics, which is one of the medications, by the way, which is not great for the kidneys because we're urinating faster and more frequently because we're on this medication. So what are we going to do? We're going to get dehydrated. We're going to lose potassium. So now we're on a potassium pill to make up for the loss for the diuretic, and the diuretic we have to take to get rid of the fluid that we're retaining because of our heart medication. And then before you know it, you're polypharmacy. Right? And that's, if you're on a diabetes medication, if you're on a statin to control high cholesterol, because those are usually the trifecta, right? We see heart stuff, diabetes, and cholesterol stuff. They tend to kind of circle around each other. And so if you're on a medication for each one, and then a medication for a side effect of that medication, now you're on 6 or 7 plus. So if you are taking multiple medications, please be aware they can affect your kidneys. Medications have to be broken down in one of 2 places, usually at least filtered, liver or kidney. Okay. So believe it or not, antibiotics, anything that ends in a sin. Okay. So neomycin, gentamicin, erythromycin, all these things that are used for infection and antibiotic use. If you have sinus infection, if you have an upper respiratory, a UTI, if you have an eye infection, a skin wound, a lot of times SINs, SCIN, are given, that's the end of the word, are given to address those things. And sometimes they can be very, very hard on the kidneys. So be aware of that. Also NSAIDs, right? Non-steroidal anti-inflammatory drugs. Say that 10 times fast. But if you're taking anything except Tylenol, aspirin, ibuprofen, naproxen, which is known as Aleve, Motrin, all those things, they are actually pretty damaging because they turn off inflammation in the body. But that same thing, it's called the COX pathway. When it's cut off, no more inflammation. You feel a little bit better, but it prevents blood flow to the kidneys. And so if blood's not getting delivered to the kidneys, it can't filter it, right? And if it can't filter it, the kidneys aren't working well. The kidneys only work as well as much blood goes through them because that's their job. So anyhow, if you're on an NSAID, like an aspirin every day, and you're having kidney issues, please talk to your doctor about potentially getting off. If you have a history of a lot of antibiotic use and your antibiotics end in CIN, please discuss to your doctor potential changes that you can make and or do things to prevent the infection in the first place if possible. Secondarily, or I guess third, that's the third thing, if you're on a diuretic or a laxative, anything that's going to make you lose fluid. Diuretic makes you pee more, laxative makes you poop more. So anything that's going to make you eliminate more is making you usually get rid of water. And dehydration is always terrible for the kidneys. Last but not least is going to be what are called proton pump inhibitors. For my folks out there who have acid reflux, okay, if you're on a PPI, proton pump inhibitor, that's going to trigger hypersensitivity and your immune system is going to react to one of its metabolites and your kidneys will not work. PPIs have a very high incidence of acute kidney failure, so please be aware. So if those are any of the things that you're taking regularly or consistently and you're noticing kidney issues, please go talk to your doctor for support and help and questions to maybe change the type of medication to do the same job but not damage the kidneys at the same time.
Yes. Okay, so the next question, this is from Frank A, who says, I have a desk job and I've heard that that's not good for your kidney. Is that true?
Oh, I'm curious to know what you think, Deanne.
I hate
What
to
do you
hear
think?
that because I'm sitting right now.
I know.
Well, what's the timeline? Ooh, I think like anytime you're sitting all day and you're not getting direct sun, like I always think that that's just not good for your health. Like make sure you stand up, walk around a lot, but I don't know it's going to directly hurt your kidneys. So I'm very curious to hear the answer.
You are usually, and in this case, you did not disappoint, very intuitively correct. Like you kind of circle, right? And I'd like to ask you, because I feel like you're like, an educated member of the general public. You're not ignorant on health and wellness in the body, but there's a lot of questions that you tend to have, right? So you're kind of in the middle. You're knowledgeable, you're smart, you catch on to things, but it's also like it's not your industry. It's not your specialty, which is, fine. So I'm just curious to know what you think. So when I saw this question, I kind of laughed because, believe it or not, the answer is yes, but we don't know why. So science we don't have a hard mechanism of action to know why sitting or being sedentary creates kidney issues. Like it's not measurable in that sense. Like, oh, sedentary people have damage in this area of the kidney or pee less or are dehydrated, or like we can't point to the cause. All we know after studying thousands and thousands of people is that the kidneys, how should I say this? People who were sedentary, women specifically, had a 30% higher risk of developing kidney issues, and men had 15 to 20% higher risk. Now, there are theories out there, which I think the theories are sound, just like you said, moving your body, getting blood flow, breathing, all that stuff. And that's what the theories right now, and the jury's out again, because we don't know for sure, but that's what the theories are pointing to, is when we move our body, when we walk, when we exercise, when we're just not sitting sedentarily, we get more blood flow. And again, like I just said, the job of the kidneys is to filter the blood. So if it's not getting a lot of blood supply, right, it's not doing its job very well. It's not going to function as efficiently. So that's where the theory is. We still don't know for sure, but the outcome we do know for sure. Sitting longer than 3 hours a day in a row will increase your chances anywhere from 15 to 30% of developing kidney issues. It's crazy.
Wow, that's 3 hours. Crazy. Yeah, I was thinking about a friend of mine. I mean, this is a past friend, but still a good guy. Nothing wrong with him. We're not. Anyway, that's not the topic. But anyways, he said that he was in a wheelchair, and he had told me that like because he's now wheelchair bound, he wasn't his whole life. He was in like a motorcycle wreck, but because he is now like he has to always have like colonics and like crazy a lot of things because of his organs not being able to do what we have the ability to do because we can walk. So yeah, just sitting all day has to affect the kidneys and more, so.
Oh, everything. Yeah. I mean, think of the pelvis or we think of the hips externally, but when you think of what the hips represent, they're just the top crest of an entire pelvic bowl. And the entire pelvic bowl, everyone, is the center of our body. It's our fulcrum. It's where all of our organs sit all day, every day. They just chill in this little fruit bowl, right? And that fruit bowl is what's responsible for connecting our top to our bottom. So there's a lot of pressure, lots of lymph nodes, lots of blood supply, lots of nerves. Everything is kind of, our most vulnerable organs are in our pelvic bowl. And so we need blood flow to all of them. And you're absolutely right. I mean, I worked for Spinal Cord Injury Association of Phoenix for a very long time, seeing their patients and educating their patient group. Catheterization, UTI, bladder infection, atrophy of muscles, constipation, issues with digesting and absorbing nutrition. all of that stuff was problematic, and they kept, you know, chronic issues we had to deal with constantly, all because they couldn't get up and walk around. So, you know, and those patients, those are my patients who had regular physical therapy where people would come to their home or they would go somewhere in office and they would move their legs, stretch them, you know, actively, passively, all the things. They usually had significantly less need for catheterization, for, you know, they had less likelihood of infection, of constipation, of bloating, because then gas can move through the intestines and the colon a lot easier. So there's less distension and pain in that sense. So yeah, I totally agree with you. And that's interesting you brought that point up, because that made me connect to the spinal cord injury. But yeah, people in wheelchairs, I'm sure, have issues like that. I know they have issues like that all the time, but this makes a lot of sense that it's because there's lack of movement in that pelvic bowl. Yeah, that makes a lot of sense.
Yeah, there we go. So scientists need to study that connection. They'll come up with their answer. We just solved it for them. So.
I know. I want to know why. I did so much digging. I was like, but why?
Yeah. If you studied that, that should be the okay, well, let's do our next question. Yeah, and the next question is from Lucy Gold. Are there any foods I should eat more of or less when I have a gout attack?
Yeah, of course. So for those of you who have watched previous episodes, you know, for those of you who are new, really quick breakdown of gout. So what do we have? We have gout at the end of the equation, let's say. Well, let's take it a step back. What is gout? It is uric acid. What causes uric acid? Kidney damage, or a diet high in what are called purines. Because when purines are broken down, a metabolite of that is uric acid. We build up too much uric acid, we get gout, okay? So if you have a gout attack and you love your purine foods, well, what the heck does that mean? How do I even know? Okay, the top 3 purine foods: alcohol. Most people drink, right? Most people drink daily. So if that is you and you have gout, just abstain, I promise. You will thank me later. Number 2, if you love meat, turkey, bacon, veal, venison, organ meats, liver, chicken livers, chicken gizzards. If you eat a lot of Asian food who use, you know, in their cuisine, they use a lot of organ meats and parts that we don't traditionally think of, red meats, things like that. If you have a diet really high in meat, then you're probably going to have a lot of purine breakdown, which puts you at risk for gout attacks if you have gout. And last but not least, shellfish. So, and not just shellfish, but some seafood in addition to shellfish as well. So when we think of shellfish, we think of what? Shrimp, lobster, crab, mollusks, clams, mussels, all that stuff. But also, believe it or not, the tiny fish. So anchovies, sardines, anything packed, you know, in high salty solution, those can also add to purines, making gout attacks worse. So by all means, please avoid the 3: alcohol, meat, and fish / shellfish. Ooh, / shellfish. Ooh, take 10 times.
Yeah, that's hard to say.
I know. And the things you want to eat, okay? You want to eat fruits and veggies high in vitamin C. Vitamin C kills uric acid. So that's what we want. We want healthy fats, healthy nuts, healthy oils, ideally raw, and then healthy, easy to break down starches and complex carbohydrates: whole wheat, barley, quinoa, amaranth, all that good stuff. You know, if you want to eat it in veggies, cauliflower, potatoes, sweet potatoes, that stuff is great to eat to help avoid a gout attack. And when in doubt, eat the rainbow, and you are definitely doing your body more of a service than alcohol and meat, for sure, especially if you have gout. Across the board, but especially if you have gout.
Okay, good stuff. All right, well, Cheryl H has our next question. See, now I can't talk. Oh my gosh, you passed.
I know. It's all the S's in the
I know. And it like brought me back.
Sorry.
I did TV
it's contagious.
news.
I'm sorry.
It is contagious. When I did TV news, whenever the word rural was in our scripts, I like freaked out because I could never say it. Like always catches me. Like it comes out weird, it sounds weird, and then the word specific. I like used to like I have this moment where I'm like, say it right, because it's like specifically. I'm like, eh. So yes, they're a hard word.
Yes.
Over articulate
like a certain word. Yeah. Rural just sounds like you have marbles in your mouth, regardless of how you pronounce it. Even if you pronounce it great, It's like, ooh, it's like you just took a bite of something and your mouth is full. Yep, every time. You're not alone. You're not alone.
Oh man, those are, yeah, there's like a whole list. I'm like, oh, and then on this show, it's always like when courses come up, I'd be like, oh gosh, am I gonna say it right? Is it corseted? Is it corseted? I still,
You know what? It's a
I think
roll
I've
of
done.
the dice. It's a roll of the dice every time. And can I be honest with you? I love that it comes out slightly different every time. I say it every episode that, you know, there's a slight mispronunciation. It really, I don't know why. It's like, to me, it's like when I see a puppy, I'm just like, oh, I don't know why. It just is. It's like probably because when I was first learning about most herbs in my field and substances, I was the same way. Never pronounced anything right reading a book. And then, you know, you read the lecture, you go to class, and then they're lecturing about it. And you're like, oh, that's how you say that word. I was not saying that right in my head the whole 6 hours of studying. Yeah.
Yes.
I get it.
So funny.
I get it.
Well, okay, well, we'll do our next question. And Cheryl asked about the Middle World uric acid detox. What exactly is in the supplement? And I'm happy to jump in here and give you a little break. So I'll share some ingredients. So this is our uric acid detox formula, and it includes 12 herbs, vitamin C, and vitamin B6. Other than 200 milligrams of tart cherries per serving, you may recognize some herbs like celery seeds, green coffee bean, cranberry, pomegranate, turmeric, all really good stuff. And cranberry and pomegranate, of course, I love those. But there are also some lesser known herbs in the formula like devil's claw, amla, yucca, and chanca pedra. So Dr. Jackie, could you jump in? First of all, go ahead and correct anything I said wrong, and then share a little more about the properties of those herbs.
No, I loved it. And that's how I say it, chanca pedra. I mean, I don't, you know, unless I'm pronouncing it wrong, which very well could be the case. But yeah, it's amla, chanca pedra, and devil's claw. Devil's claw is self-explanatory. But okay. So properties of these herbs. Well, first and foremost, with the chanca pedra, let's get that out of the way so I don't have to keep saying it. But it actually prevents gout attacks by clearing uric acid faster through the kidneys. And so if you are eating a diet high in purines, let's say you're getting a gout attack and you're like, crap, I don't want to go through this another day or two. What you can do is take chanca pedra or supplements that contain chanca pedra, and you should be able to prevent the gout attack from getting worse. You can kind of stop it in its tracks. And studies actually show that it's going to decrease almost overnight uric acid levels holistically, like not just in urine, but in your whole body, like in your serum, in your joints, everywhere. So chanca pedra goes everywhere, which is fantastic to lower uric acid levels. So that's in there. The second thing is going to be those amla berries. We might know them, pardon me, I scratch. We might know them as gooseberries for anybody who harvests and or eats gooseberries if they grow in your neck of the woods. But gooseberries are unique because they're super high in antioxidants and really high in vitamin C. And if you remember me saying a few minutes ago, vitamin C squashes and helps alleviate and or eliminate uric acid, high uric acid in the body. So now we have chanca pedra, which definitely addresses uric acid, but now we have amla berries, which are really high antioxidants and high in vitamin C, which is a natural antioxidant as well. And so now we're helping the immune system, we're helping the integrity of the joint, of the blood, of the nerve, basically everything that could be having oxidative stress because of the gout, we're addressing with the amla berries. It's also really great for heart disease, diabetes, and cancer, just to name a few. It's very powerful. And then last but not least, we have the devil's claw. So devil's claw is more of an anti-inflammatory. And so the amla berry was antioxidant and vitamin C, where the devil's claw is more anti-inflammatory. So it's going to help with the inflammation. So for those of you who don't have gout, you don't know the exquisite pain associated. That's actually a medical term, exquisite pain associated to gout. It's like walking on Legos all day. For those of you who've accidentally walked on a Lego, you know the pain. And so, you know, uric acid crystals are really jagged. They're like little saws. So if you have a high population of uric acid crystals in your tiny toe, I mean, it's your big toe, but compared to other organs, it's a tiny little space. it's going to cause inflammation. It's going to be hot, red, angry, painful, again, like you're walking on Legos all day. And so to address the painful, inflammatory, kind of swelling redness aspect, that's why the devil's claw is in there. So now we're lowering uric acid, we're addressing oxidative stress, and we're addressing inflammation. And that's what all three herbs, they have very unique skill sets in that area, specific to uric acid, specific to joints and kidney health. They do a few other things, but in terms of what we're talking about today, those are their superpowers.
Okay. All right. Well, here's a question from Deep Tea about gout. So she said, my gout really calmed down with the supplement, but do I need to keep taking it or can I stop? I don't want to get gout again. Because obviously she doesn't want to be stepping on Legos. Ouch.
I know. Have you ever stepped on a Lego though? Let's be real.
Yeah. Well, I like my life coming up because they play with those bigger ones, but they're starting to get smaller and smaller. And I'm like, oh no, I don't want this. But
wait.
Yeah.
Wait.
Just wait.
Yeah. So it's, we all know, regardless of the size of the Lego, it's never fun. So yeah, people with gout, and what I mentioned before, we're always standing, sitting, using our feet up and down. You know, it's like everything is on the foot, right? Everything's on the bottom. And so when you have gout, it affects everything. And it's like, yeah, okay, I have gout. I don't want to have kidney issues. I don't want to have joint issues. I got to get up. I got to move. But every time I move, I'm walking on Legos. Do I just sit still and rest and let my body heal? Or do I, I don't want to be too sedentary and sit at the desk all day. And so you kind of are, in this middle, what do I do? How do I help myself the most? Anyhow, the supplement question, I believe you asked, I don't want to get gout again. The supplement helped. Should I keep taking it or stop? A good way to know is if you have any symptoms or any signs whatsoever, even a small level, you want to maintain taking the supplement and making the dietary changes. Now, a lot of people, especially in practice with me, they want to maintain, I've noticed, they want to maintain eating, drinking, doing everything that they're doing. They want the supplements to address their lifestyle stuff, right? So they're lighting the fire and then they want to take things that put the fire out, let's say. When you can kind of put that fire out or keep it at a very low flame yourself instead of a full explosion by lifestyle stuff. So if you're eating foods low in purines, if you're eating foods high in antioxidants and vitamin C, if you're eating high inflammatory foods, anti-inflammatory foods, you're going to help your body prevent a gout attack. The supplement is cherry on the sundae, right? Icing on the cake, whatever. Maybe I'm hungry. But my analogies are food centered. But if you're not doing the basic foundational stuff, the supplement will only keep the gout at bay for so long. If you are doing the foundational stuff and you're taking the supplement and you're noticing no symptoms, then try to take the supplement away or lower the supplement and see if your lifestyle foundations are working well enough to keep the gout attack at bay. Now, if you do that after a week and you notice even just a slight whisper of increased pain, discomfort, inflammation, anything surrounding gout, immediately introduce that supplement again because it was doing a specific job. So I always say supplements it's built in the name. It's to supplement a healthy diet and lifestyle. Supplements are fantastic for addressing issues, for getting us out of the woods. And for some who have chronic issues, help maintain, right? Help manage that chronic issue. When it comes to gout though, gout can be in complete remission and for a very long period of time if we have this lifestyle, foundational food, all that good stuff going on. So then the supplement is kind of like a fail-safe, right? We have it on guard when we need it. It's almost like a cold season, right? You don't have a cold all year. You don't have flares of colds all year round, but you keep cold medicine or cold supplements or immune supplements on the shelf for when and if that does happen, and the early signs and symptoms, right? So you're paying close attention. So it's the same thing with gout. When in doubt, stay on it. If you're having no signs and symptoms, start to titrate off and see if you can go off of it. If you have any slight whisper of an attack coming up, go back on it immediately.
Okay, good advice. All right, Luca.
Yeah.
Yeah.
What was that?
Oh, that's good. So Luca asked the next question: is gout more common in men or women? and at what age? Just trying to figure out if I'm at risk.
Okay, so it's 2 to 3 times higher in men than women. And we talked about this, Dan. The protective qualities of estrogen and how menopause, we're so looking forward to it. But gout usually I know. Gout usually happens in women older because estrogen protects us, believe it or not, protects our joints and our bones and, you know, things like that from developing gout. Hormones actually have, or estrogen specifically, has a mild, it's called uric effect, which means it prevents uric acid from building up in the joints. And so women are less likely to develop it. And then if they do develop it, about 2 to 3% of women in their lifetime will develop gout. When they do, they tend to be older. Not always. Again, there's exceptions to every rule, but they tend to be, you know, post-menopausal. Men, on the other hand, have about a 6% chance compared to 2 in women. So 6% chance, and that's most of the diagnoses occur between 30 and 60. So if you're a male between 30 and 60, you have a high purine diet, you have joint pain, you are, you know, you drink a lot of alcohol, you don't have a great foundational diet, lifestyle, drink enough water, all that good stuff, you're probably at a higher risk than, let's say, you know, a 25-year-old woman who is in her prime procreative years and who, you know, works out, doesn't eat purines, and drinks a lot of water, right? So the risk is about 3 times higher for the guy over here than the woman over here. But then that kind of starts to edge up for women the older that we get, due to the lack of estrogen was protecting us from uric acid buildup the whole time.
Okay.
I hope that makes sense, what I'm saying.
Yeah.
That makes sense? Okay.
Yeah. It made sense. Okay, so we have Arizona Rachel. I heard cherries are good for kidneys. I like cherries. How much should I eat to improve my kidney health, or should I just take a supplement?
So yeah, black cherries, dark cherries, tart cherries, which I know is in the supplement, which is awesome. Yeah, if you eat anywhere from 10 to 20 a day, you can prevent gout. You have about a 35% lower risk of a gout attack or flare up if you're eating that many cherries every single day. But usually that's not sustainable for most people. And usually cherries aren't always in season. So if you cannot afford time, money, seasonality, convenience, whatever, to eat 15, let's say, cherries, black cherries a day, and not Rainier, not the white kind, not the pink kind, but the dark black cherries, tart cherries, then the supplement is definitely going to be best for sure, because it's concentrated tart cherry and black cherry. It's the right kind. It's the right amount. You don't have to go to the grocery store. You don't have to prep anything. Nothing goes bad. You don't have to throw it out. So if it's a convenience factor, then you know, in a time, money, all that good stuff factor, then the supplement's going to be better. But if you do like to use food as medicine, you want to utilize food to address gout and or prevent a potential flare attack, then I would highly recommend the 10 to 20 cherries per day, every day. And the range is 10 to 20 because every cherry is different. Some are big, some are small, and every person's different. Some are big, some are small. So if you can just get in that range, 10 to 20 a day, after a few days, even just 2 to 3 days, in studies, patients were showing significant improvement in their gout attack. So it's really, you know, 6 in one, half dozen in the other, just depends on you, your goals, your life, your budget, and all that stuff.
Okay, so I went to Trader Joe's recently and I bought a bag of dried, I think it's either tart or dark cherries, but does that count, or when they're not the same?
So when they're dried, it does still have some of the properties. The vitamin C is going to be there, right? The antioxidant effect is going to be there. But what we're missing from dried cherries, 2 things usually occur. Well, number 1 is the alive flavonoids, right? All the time we talk about phytochemicals and flavonoids, and that's a fancy word. That's coming from an alive plant. So we lose that power, okay? So it will diminish the ability to address gout when it's dried. Secondarily, most dried fruit adds either sugar or some sort of like sulfur additive, sulfide, something to preserve it. And so if you're dried cherries, I would check the label. If it has any added sugar, any preservatives.
Yeah.
What was
I
that?
did go for the no. I did check for sugar and it didn't have that, but I'm sure it has some sort of preservative then.
So then now we don't have the phytochemical or the flavonoid, and our body is taxed with processing some sort of additional preservative. So in that case,
Right.
if it was dried cherries or the supplement, I would always choose the supplement, right? I would say dried cherries, supplement, real cherries, raw cherries, right? If we're looking for a hierarchy. Although there's something really convenient about having the supplement. Like for me, I'm traveling right now. Clearly, the set is a little different than we're used to. But having supplements on hand is super convenient because they're just right there. You can always depend on it. I don't have to worry about running to the grocery store, to make sure I get my daily dose of probiotics from fermented foods, or if I did have gout and I needed tart cherries, making sure everything was there every single day. The convenience of having that supplement on hand is really, really helpful. So use food as medicine when possible, convenient, and budget friendly. And have the supplement on hand as a nice backup and a support, because again, it's built in the name. It's a supplement. It supplements a healthy diet, right?
Yes, definitely. Okay, that was really interesting. All right, the next name, you're going to like this one. Hippie Puppy. Hippie Puppy asked.
I love it.
So
I don't know if you noticed. I think you did. Yeah, because we're friends, clearly. We talk on Instagram, but I'm Hippie Doctor.
Yeah.
With an A.
You guys need to be friends.
Maybe
it's an Instagram dog. It could be just like a little dog.
That would be awesome.
Like surrounded. Oh my gosh, so cute. All right, so puppy for you. Does this supplement also help with joint pain?
Oh, this is a good one. Yes. So uric acid doesn't just take up space in the big toe. I think a lot of people, because we associate uric acid to gout, think that uric acid is only a big toe issue. But uric acid likes to hide in any joint it can hide in. Its favorite spot is the big toe. But it can hide in any joint. So if you're having joint pain, if you are, I recently, when the keto diet had a big, it was kind of trendy 3-4 years ago. It was like the big new thing. About 6-12 months into that, I noticed a big wave of all of these athletes coming in and having certain gout related or kidney related issues because they were eating so much protein and fat, which is again, all animal products, fish, shellfish. I said that correctly.
Yeah.
Organ meat, and any kind of meat they could get their hands on, right? Because we're avoiding carbs in the keto diet, for those of you who might not know. So again, that's basically all I see as their doctor is purines, purines, purines. So, if their gout's flaring up, it's pretty obvious. So again, my point is your diet dictates how well your body clears uric acid, as well as your kidney health, of course. So your kidney health, your diet. They combine how well you clear uric acid. Even if you don't have gout, but you have joint pain, this can potentially help. Again, antioxidant, anti-inflammatory, and lowers uric acid in the whole body, not just locally at the big toe. So although there are like chondroitin sulfate and glucosamine and other really great substances that help with generalized joint pain and repairing, which I know, or I believe Middle World has a supplement that has all that good stuff in it too. But relating to uric acid buildup in joints and that causing pain, this supplement will definitely address way more than gout for sure.
That's good. Yes. Okay. So our next question is from Cheryl H. She asked about Middle World Uric Acid Detox. Where is this supplement made? And I'm happy to take this one as well. So we have a little video to play as well to show our manufacturing of it. All of our supplements are made here in the USA, specifically in Georgia, and they're made in a GMP certified facility, which stands for Good Manufacturing Practices. And it's a certification only given in recognition of the fact that these products are consistently produced, controlled, and adhere to quality standards. We get FDA announced and unannounced inspections, and we test each lot in the independent lab before it's shipped out. And some of the things we're looking for are potency, purity, and if there are any heavy metals or contaminants. And only if it passes then it gets shipped out. So everything is really high quality when you are ordering through us, which I love. Okay, so our next question is from Health and Beauty 2003. What if I don't see the results? What is your return policy on these supplements? And I can take this one as well. So
That's
every
you too,
person,
yeah.
every person is different. What works for one person just might not work for someone else, and we totally understand that. So we actually have a 60-day return policy, and you can get 100% of your money back. So even if that means you opened that bottle, used it for weeks, and it's half empty, you can still send it back. So we want you to have a good experience. We want it to be stress-free. And if you have any questions, you can always contact us through the link on Amazon. Okay, so our next question is for Dr. Jacquie. And I know this one's a little different, but because you're interested in psychology, I think you're going to be able to tackle this one. What emotion is stored in the kidneys?
Ooh, that is a good question. So Western psych hasn't quite caught up to traditional Chinese medicine and Ayurvedic medicine. For those of you who are interested and or familiar with things like acupuncture, acupressure, energy medicines, the idea that the body houses our emotions, past, present, potential future, depending on how we use our mind, then you might align with this. So psychologically speaking, medically speaking, there's no like double blind placebo peer reviewed kind of study about this, but traditionally speaking, with traditional Chinese medicine and Ayurveda, esoteric medicines that have been around thousands of years, for them there's a very, very strong connection. And in the kidney, the idea is it's the house of fear. Okay, so if you have a manifestation of chronic fear of what others think of you. So maybe it's hyper insecurity, people pleasing, maybe fear of future. So you have anxiety, you use your imagination to worry constantly. Any weak willpower, perhaps. Maybe you want to set goals and you keep failing because you just don't believe you're afraid of success or you're afraid of failure. Anything that's motivated by fear, or if we're isolating ourselves, fear of others, fear of being perceived by others, all of that stuff in Chinese medicine, emotionally and energetically, is correlated to the kidney or organs associated to the water element. Because what do kidneys do? It filters the blood to send urine to the bladder to release fluid, right? And so water is the element associated to that. So it's a normal adaptive emotion, fear, right? We need fear. It's going to keep us protected. Don't touch that hot thing. I'm a little afraid of being burned. Okay. I'm not going to lose sleep over, that hot thing, but I'm not going to touch it either. So it's there for a reason. But when it becomes chronic and we ignore it and it gets worse and worse and worse and causing kidney damage, I urge you, if you do have kidney issues or history of kidney stuff, really taking a moment to breathe and reflect and think, do I have a pattern of anxiety, worry, fear states, insecurity, isolation, especially fear around loving and being loved, or seeing and being seen? That fear of like exposure, vulnerability, that's a big one. But also fear of future is another big one. So when we're dealing with that, we tend to see flares in kidney and bladder related issues in traditional Chinese medicine and Ayurveda. So yeah, if you fear in kidneys, man, I'm telling you, if you have kidney issues, reflect on fear. If you're in a very fearful state or have been for a very long time, really be gentle with the kidneys, eating foods healthy for the kidneys to support them. Low purines, high water, high hydration, and all that good stuff is going to be very, very helpful to help balance out any potential energy imbalance that is leading into either the fear, the kidney stuff, or both. So yeah, that's the connection there.
I think that's so fascinating. That's so cool. Okay.
I love it.
I do too. Like, why can't medicine catch up? Come on. Like, we'll get there one day. Okay, so next question, and we have time for probably a few more. Forgive and Love 09. Last time I bought your supplement, it came with a little charm that said, over every mountain there's a path. I thought that was sweet. Will I get another one? And the answer is yes. Yes, you will get another one. You get a charm on every single one. We call them the Middle World Whisper. And each one's different. It's basically to help you set an intention. It's a positive mantra. Mine here says detox your body, your mind, and your contact list. This one says it's a good day for a good day. So each one's different. And then when you're done with your bottle, you can use it to attach it to a zipper on like a backpack. You can use it as attach it to a keychain hanging in your car, put it on as like a gift tag for a gift. So you can reuse them as well. So positive messaging on our packaging, which I love. All right, let's do another question by Scott R. Can kidneys repair themselves over time? Are they like the starfish of the body, which we know the liver is? So what about kidneys?
I love that. Is the liver or are the kidneys the starfish of the body? So unlike the liver, kidneys cannot regenerate themselves. However, they can repair themselves throughout life. They can regenerate to a small degree, but they can't lose an entire lobe or aspect and then regrow it like the liver. There's too many moving parts. The liver is pretty much all hepatocytes with a couple of specific changes, where the kidney is a functional unit wrapped around something, enclosed in something else. If you saw the anatomy of the kidney, there's so much going on, so many layers and filtration and loop of Henle, and it's thick here and it's thin there and it's diffuse there and not there. Think of like, a pasta strainer has big holes, and then a flour sifter has small holes, and then you have like a juice bag, or if you're making like almond milk, the nut milk bags that you have, it's like the holes get smaller and smaller and smaller because we're straining different things. It's essentially the kidney has that. It has different straining sizes throughout. And so when damage happens in one area, it can be difficult to fully regrow that lobe or that area, but small issues like acute infection, potential cysts or blockages, acute inflammation of the kidney failure, all that stuff can be reversible, and the kidney can heal itself. However, unfortunately, it is not the starfish of the body like the liver. That award goes to the liver for sure. Now, if you have chronic kidney issues, unfortunately, all you can really do is manage it and keep it at bay or keep it from getting worse. You can't really reverse the hands of time per se, and like I said, regenerate. But you can definitely do a lot of help for yourself and support in addressing it. But yeah, not the starfish of the body, unfortunately.
All right, well, let's do one last question before we have to wrap up. And this one is also from Scott R. So he wanted to know, I'm not sure if it's my back hurt or my kidneys. How can I tell?
Kidney pain is typically higher on your back than we think. So when your low back hurts, your really low back, and in the center or going out over your glutes, let's say, like that band at the low back, that's not going to be kidney pain, especially if it's worse with certain movements, exercises, or work-related conditions, like when I sit for a long time or when I have to stock this shelf, or that's not going to be kidney pain. Kidney pain is pretty chronic. It's consistent and it's very deep. It's like internal. It's not muscular. Like when I move, it hurts. It's almost all the time. But a fail-safe way to know that if you have kidney issues, like if the back pain is kidney issues, you can do what's called the kidney punch test. Don't do it hard, but at the bottom on the back of the 12th rib, which is your last rib, if you place your hand on the back, let's say someone's 12th rib is right here above my hand, and I'm off to the side, not the center where the spine is, but off to the side, I'm going to give it a little tap, tap. Or just a single tap, just something a nice firm, but not very, very hard like you're knocking on a door or anything. If the person winces in pain or the pain increases, that's a good chance that it could indicate some kidney stuff going on, and that the back pain is kidney related. But if it's lower, it's aggravated or triggered by things or alleviated by other things, it's probably not kidney issues. But again, when in doubt, go, definitely talk to your doctor for sure.
Get it checked out. Yes. Okay, well, we have to wrap, so why don't we leave everyone with just the top 3 things that you want them to remember from today's episode?
I think the top three things are food as medicine when it comes to a foundation of health. Supplements to supplement are amazing in terms of convenience, shelf stability, and then usability. And third, again, I think I said it like 6 times, so I might sound like a broken record, but please, kidney, heart, like certain things you don't really want to mess around with, and the kidneys are one of them. So if you have any doubt, any intuitive pull, any question in the back of your head, just go get screened, go get tested, go talk to your doctor. Safe than sorry. So those are the three for sure.
Hey, those are really good. Well, we look forward to seeing everyone next week. We'll be on at our regular times, and it's Amazon Prime Day next week too, so it'll be a very special show. So we're super excited for that. And have a wonderful rest of your evening. So I'll say goodbye, and you can say goodbye too.
Thank you. Just everyone remember, the kidneys are a main filtration station and toxin removal channel. So give them love. Give them a little hug today. They're worth it. They work real hard for you all day, every day, and they never ask for a thank you. So maybe give them some love. And thank you so much for all your questions, and keep them coming for future episodes. Love it. So thank you. Have a great night, everyone.
Yeah, good night, everyone. Everyone keep the questions coming in.
Hear the whispers from within, balance to restore, ailings to relieve. Feel the nature keeping us, nature healing us. Flowers, leaves, and roots within. Hear the mind calming you, soothing you. Love and kindness inside out. Let the herbs from middle world heal. Welcome wellness, welcome wellness. It's revealed herbs, middle world herb.